I'm Dr. Sandra Brown. I'm an ophthalmologist in North Carolina. I have no financial conflicts of interest. I'd like to talk to you today about Sludge2, what you get when MBAs make biologic drugs. I really recommend that you watch the original Sludge before you watch this video. You'll enjoy this video much more. I need to share with you first Rebecca's quotable quote of one of our recent phone calls. If it's in a bottle, it's not a tissue. First of all, amniotic fluid is a liquid, not a solid, so it never qualifies as a tissue. And secondly, placenta, which is a tissue, has to be put through a blender before you can get it into a bottle. Therefore, it is no longer a tissue. Just keep this in mind when somebody's trying to explain to you how a biologic eye drop is really an allograft tissue, because no, it's not. A quick recap on BioLab Sciences. I found BioLab Sciences when I was looking into a product called AmDrop, which is distributed by Progress Medical. This was my new headache, and to learn more about AmDrop, see the video. You won't eat GMO, but you'll put this in your eyes, part 3. I thought I would chat up Progress Medical, so I emailed them. I said, hey, do you still sell AmDrop in the eye drop bottle for eyes? Because I found an ad for it with one of the dry eye online retailers, but they don't carry it anymore. Progress Medical got back to me quite promptly and said, well, there are no retailers anymore, but they're happy to sell me the amniotic fluid directly. And then I could make it into eye drops myself if I wanted. I asked them a little bit about how it was packaged, and you can see a snip of a screenshot that shows a clear vial with an ordinary screw cap inside a peel pack. AmDrop has its origin in BioLab Sciences. BioLab Sciences makes a couple of amniotic fluid products, which they happily refer to as allografts. Take a look at the underlined information below. It's ready-to-use flowable graft. No, it's not, but okay, with no thawing. And it can be stored at room temperature. What's in it? The usual magical protein matrix. Down below, you can see the acronyms for the typical proteins we see: insulin-like growth factor, which is IGF, transforming growth factor, a couple different subtypes, that's TGF, TIMP, BIMP, etc. I asked about the shelf life, and they said, well, this product has a 1-year shelf life. In which case, why is this still around? The expiration date is January of 2022. And when I asked about how the product was packaged, I really feel like the guy I was emailing with just took a quick photo with his phone and sent me that photo. So unless for some reason they had an old photograph lingering, what was lingering was this shrink-wrapped package of amniotic fluid. I'd really throw that one out. I asked a little bit more. I asked about terminal sterilization because the product was advertised to me as being terminally sterilized. This came up as the gentleman at Progress Medical was continuing to encourage me to purchase it. He got in touch with BioLab Sciences and emailed back. I hope this answers your question, as manufacturers only divulge so much. Well, so much was enough, because BioLab Sciences said their amniotic fluid products were processed as tissue products following aseptic techniques and afterwards terminally sterilized via gamma irradiation. And this is what Snail and I have to say to that. We once again collapsed laughing. And I'm going to explain why after I rest up a bit. First of all, what is terminal sterilization? Terminal sterilization refers to sterilizing drugs after they have been placed into their primary packaging. In the case of eye drops, the primary packaging is the bottle, not the box. Terminal sterilization is, in fact, the most effective form of sterilization because there are no additional manufacturing steps that involve humans, which could reintroduce contamination. The common methods of terminal sterilization are moist heat, dry heat, gas, sometimes chemicals, or radiation. The purpose of terminal sterilization is to kill infectious organisms. And these infectious organisms are bacteria, viruses, prions, spirochetes, fungi, and other things, including bad things like acanthamoeba. What are these evil creatures made of? Proteins, DNA, RNA, lipids, glycosaminoglycans, and lipopolysaccharides, maybe a few other ingredients thrown in, but highlighted in red, proteins. What do geeks have to say about gamma rays and proteins? There are lots of hurtful words in these screenshots: oxidation, rupture, cross-linking, fragmentation, aggregation, and irreversible. Gamma irradiation causes conformational changes in proteins, and as we know from Sludge2, a conformational change will render the protein non-functional. The middle screenshot says specifically that gamma irradiation will significantly change the molecular structure, particularly of fragile biologics such as cytokines, chemokines, and growth factors. In other words, all of those lovely ingredients that BioLab Sciences was bragging was in its amniotic fluid products. And down below we see the sad news that gamma irradiation causes irreversible changes to proteins at the molecular level. What do pharmacists have to say about doing it right? And by it, I mean doing the very best you can to sterilize a biological product. They say flat out, most biologic drug substances are unstable when exposed to radiation. They require sterile filtration. And down below, once again, from something called Pharma's Almanac, sterilization methods using radiation will, for instance, cause degradation of most biologic drug substances. So this is how you make Sludge2 faster than microwave popcorn. Take that amniotic fluid in that clear vial, tuck it into that peel-packed pouch, send it off to your gamma irradiation facility, and just like that, you get Sludge2. Let's back up and take a look at that FDA warning letter to BioLab Sciences in more detail. First of all, the FDA is pretty clear that what BioLab is doing is illegal. They say, we have determined that your actions have violated the Food, Drug, and Cosmetic Act and the Public Health Service Act. Those are two really big, important acts in the world of medicine and pharmaceuticals. Also, those products are possibly not sterile. BioLab Sciences had no written procedures designed to prevent microbiological contamination of drug products purporting to be sterile. And these are just the outtakes of these long paragraphs in which the FDA details all the many, many defects in BioLab Sciences processes. Third, those clean rooms were definitely not clean. They found in those clean rooms bacillus, fictibacillus, bacillus, gram-positive cocci, fungi, and another bacillus. And I suspect that that's a truncated list of what was found in those not clean rooms. And there was no effort whatsoever to obtain credible evidence as to the 1-year shelf life. As the FDA says, your firm has assigned a 12-month expiration date to your amniotic fluid products without supporting data from stability testing. Well, you can't really test something for stability when you've cooked it with gamma irradiation right up front, because it's already sludge. Also, the FDA told BioLab Sciences to throw their stuff out. They said, you better provide us with specific plans for the disposition of all these products. And you can see that list of amniotic fluid products. Stimulize is not on it, but only because BioLab Sciences no longer makes Stimulize. Summing up so far, gamma irradiation causes instant Sludge2. I mean, hey, why wait for room temperature protein degradation? So if you're using any BioLab Science amniotic fluid product that was terminally sterilized with gamma irradiation, you paid something for nothing. BioLab Sciences clean rooms aren't. And all their amniotic fluid products are unapproved and therefore illegal to market or sell. What they're currently marketing and selling is something called Fluid GF and something else called Restore GF. I suspect these are not really different. What you see in the upper right-hand corner is a pretty scary image to me of sort of deadly-looking blue rays, and in fact, they are deadly, because this is cobalt-60 emitting gamma rays. BioLab Sciences plays the same tired regenerative medicine legal tunes. I'm tired of that music, and I'm sure you are tired of me singing to the music. First of all, as they all do, They pretend that a liquid is a tissue or an allograft. They pretend to be regulated solely as a PHS Act Section 361 product. And they separately pretend to be an exempt tissue product under our friend 21 CFR Part 1271. The problem with this is that, number one, amniotic fluid is not a tissue, and number two, even if it was, BLS's products would not be exempt. And for those of you who have gotten deep into the Code of Federal Regulations, as I have, you'll know that those two pretends mean the same thing legally. So then I had to ask, who are these people? And conveniently enough, they actually have an Our Team link on their webpage. So they have a CEO whose background was in telecommunications. They have a CCO. This is a new one for me. The C means commercialization, with a background in photocopy machines and lab tests. Their CFO, the usual. And then they have a CSO, the science guy, who has a nice biography in which he is described as a biotech startup consultant. And as an aside, he founded a company called AmberStem, which brings to us the versatility of biofarming. Because I had the full name of the CSO, I could look him up on PubMed. He has a PhD in molecular biology. Under his full name, I found a total of 8 articles listed between 2004 and 2021. That is not a lot. One was about anesthesia for colonoscopies in Peru. 4 were about international infertility research. There was an article on embryo transfer in Bolivia, and 2 slightly more plausible articles on vitamin D metabolism. If you cross out the very unlikely citations, we've got 2 total. I really couldn't even find anything that seemed to come up under PubMed that would be related to his actual PhD research. Generally, when you're getting your PhD, you end up as a co-author on at least a couple articles that are being generated by your lab. Maybe they just weren't listed in PubMed. Or maybe they don't exist. So, for those of you who've been following all these videos, remember that line I threw out there, well, snail really, about the possibility of an Uber scammer. An Uber scammer is someone, typically with a PhD, who persuades people who don't know any better at all and have no background in pharmaceuticals to invest in regenerative medicine companies. And I think we might have found one. Because if this guy's PhD is real, there is no way that he doesn't know that gamma irradiation nukes protein structure. And let's not forget, connected to absolutely nothing related to regenerative medicine, the guy is also a biofarmer. But no snails. So my snail is safe. You might want to take a look at that AmberStem webpage. If you get more than one hit, add the word California to it. The webpage is really pretty. I mean, it's very nicely done. It's got a nice team photo. A little bit tough to find the address. I had to find that someplace else, but it's in Southern California. I think probably the key graphic in that entire website, though, is the very pretty picture at the bottom that says, "Contact us for investment opportunities." And this would be very, very ground floor investment because nowhere on that webpage could I find a list of actual products for sale. Well, in one of our late evening, for me, conversations, Rebecca and I had a brief sympathetic moment. She said, the McGee Group seems like a totally legitimate business. And as a reminder, the McGee Group is part of the joint venture that created M2 Biologics, which sells Stimulize. And I said, well, so you think they got taken in by a smooth-talking PhD? She reminded me that Uber Scammer was my idea. I said, no, it was really Snail's idea. And anyway, at the time, it was just a joke. But I have to admit, that joke was later supported by the biography of the BioLab Sciences chief scientific officer. So Rebecca threw out there, maybe we feel a little bit sympathetic towards the McGees, especially if Stimulize, which has vanished, doesn't reappear as a pretender over-the-counter eye drop. We thought about that. We were feeling kindly. The weather was beautiful in North Carolina, and we agreed. Dear McGee Group, if you were had, call us. Be smart. buy drugs manufactured by real drug companies. Neobiosis is the current manufacturer of Stimulize, which is never inspected sludge. They are manufacturing and selling a not FDA-approved, unlicensed biologic drug. BioLab Sciences, the former manufacturer of Stimulize, got a warning letter, so we'll call that warning letter Sludge2. Also shamelessly manufacturing and selling a not FDA-approved, unlicensed biologic drug. In fact, they're still doing it because they're selling other amniotic fluid products. I hope this presentation has helped you to understand that scientific dishonesty in the regenerative medicine industry is rampant. You shouldn't trust any of it. And you certainly shouldn't drip an amniotic fluid product in your eyes. Thank you for listening.